Hello, and welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm here with Dr. Sam Lau. Now, many of you may know Dr. Lau. He's been speaking for some time in our industry. In fact, I understand he's spoken in every state. But in addition to that, he has 35 years of private practice experience in periodontics and implant placement. He's also professor emeritus at University of Florida College of Dentistry, among many other honors, awards, and achievements, which are too much to list here. But it's such an honor, Sam, to work with you through the Dental Speakers Bureau. And thank you for being here today to chat with us about your course, How to Manage the 4 Top Dental Conditions of Today's Baby Boomer. So welcome, first of all.
Welcome. Thank you.
And let's just dive right in. What is the challenge that the practice may be facing that this course can resolve for them? Why is this course relevant?
Well, actually, I am an expert on the subject because I am one. And so I can speak with authority about it. But as I begin to take a look, I realized in my own practice and looking at trending that the baby boomer generation was escalating, if anything, in sheer numbers. And that as I began to look at my own patients and appreciate, AARD, that there was, to a certain degree, conditions that were not totally unique to this population, but very much part of this population. And then I began to say to myself, well, what if I designed a course for not only helping you as the dentist, hygienist, team member, periodontist specialist in dealing with this particular population, but also how to interact with this population. In other words, how to communicate with this population. And then, I've always been fascinated with generations. Now, I don't like to typecast because then that creates into issues. Mm-hmm. But there are generational differences. And then the more I delved into generations, then I began to appreciate really how to communicate with different generations. When I started doing this course, it really had to do with baby boomer patients. But then as I began to move forward, then I started moving it also into us. In other words, a hygienist that may be a millennial. How do you manage her versus a hygienist that's a centennial or a hygienist that's an Xer? And so, and that came, and it wasn't intended, but what happened is I could see in the whites of the audience's eyes that they could identify with certain generations.
Sure.
And then when I said to dentists, there is a difference when you're interviewing a millennial hygienist and they say, oh yeah, I can tell you, especially if they were what? A baby booming dentist.
Oh, sure.
And also, let's face it, we have children and we have grandchildren. We have parents, we have grandparents. So everyone is really able to identify. So I said to myself, why don't we find, because I'm into really being focused, why don't we find the 4 major conditions somewhat unique to the baby boomer? And then they begin to quickly pop out. Being a periodontist, guess what? 67% of all baby boomers have gum disease.
Wow.
So that was quick to be able to do that one.
Mm-hmm.
If you're aware of what's going on with dry mouth, that was a very quick one because of all the medications that baby boomers are on. Then that came into how to manage caries, not just caries above the gum, but caries below the gum. And then I ended it with one of my favorite topics, unfortunately, and that is implant disease. Just because an implant is there, but what population has the most implants? It's the population that has the possibility of having the need for the implant. In other words, losing a tooth. And secondly, let's face it, it's more an affluent population that has implants. Sure. So it was very easy. So we go through every one of those conditions. We go through and we discuss from the standpoint of the etiology, how it happens. But the most important thing we discuss is how to manage each one of those conditions, looking at the state of the art, what you can do in your practice, on a Monday morning. So to a certain degree, but then it also sort of crescendos with how to talk with them, how to understand them. Because if you're a millennial dentist, do you really understand walking in my shoes as a baby boomer, and vice versa? And so we go through all of those things. What resonates with a baby boomer? What offends a baby boomer? Or what's the talk track? Because the bottom line, Vanessa, for us as dentists and to a certain degree hygienists, we may have a treatment plan, but we got to sell a treatment plan. I think we forget that. I think 40 years ago, you could say whatever, and a patient said, okay, fine.
Yeah.
Not today. Today, you've got to sell yourself, and you have got to sell your treatment plan. So what better way to do that than know what? Know your customer.
Sure. It all goes back to relationships and communication, doesn't it? I love this idea.
Absolutely back to communication, trust and communication, your mannerisms, what you look, how you dress. Baby boomers don't like people walking in with scrubs. I can promise you that you slept in. Baby boomers expect you to come in there with a little bit of a shirt and tie, and and sorry, some of you, I mean, it may offend some, but I would rather look into the eye of a tiger and tell you what they're wanting than try to give you something thinking that everything's okay.
Yeah. Yeah, it's important to know. And I love that this is a really unique course. And I'm assuming then this is something that would be appropriate for the dentist and team to attend?
Absolutely. I actually, with the exception of workshops, I like my courses to really appeal to the entire team.
Excellent.
And I actually even have dentist spouses come in to these courses. I think we've gone a little bit away. I have technique, don't get me wrong, but I think we've gone a little bit away from just technique, 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 technique. I know that's what we were or are as dentists, but it's not just about technique. It's about how you demonstrate. You can't do a technique unless somebody wants it. I keep telling dentists this. You can be the excellent with technique, but if nobody wants you, then it doesn't make any difference.
Right. It's about understanding the whole scope, all of it. In my mind, I think of it as a stew, that there's all these different elements that come together to make it work.
And I'm a cook. So yeah, it's not just about the carrots.
Yeah.
I mean, it's about the whole
meat.
thing, for the taste bud stuff.
Exactly, and the seasoning and everything. So this is normally a partial day, or what's the best format for this course?
This is a course that really does the best in a partial day, a half day. It's a punch, it's a capsule. I do courses that are full days, especially like the innovative. But I'm finding now that when I do this course, what I will do with this course is actually, for an event planner, is do this course like in the morning or afternoon, and do one of my other half-day courses to break it up. I rarely ever have anyone leave. That's my mission. It's kind of like, if I see somebody leave, I actually sometimes make a joke. I say, if I see you leave and not come back, I'm going to hunt you down and shoot you. I'm kidding. But my objective is for you to stay there for the entire time.
Yeah.
We'll take a break, but I actually bundle this course by itself, like if we're at a regional or state national meeting, or if it's even a local society, we will bundle this course to where we'll do this course and maybe more emphasis on the implantitis, how to manage implantitis, since it's so popular right now. But I can do that. Or sometimes I will do this. I'll do this course and then a workshop in the afternoon.
Well, you have multiple offerings to choose from, and that should be stated. And so all of those presentations can be found at dentalspeakersbureau.com, or you can also go directly to Dr. Lau's website, which is drsam, S-A-M, Lau, L-O-W.com, drsamlau.com. But before we wrap it up, Sam, is there anything that we haven't chatted about regarding this course that would be important for the meeting planner to know?
Sure. There are courses out there that sort of seem similar. This is not a course for the elderly. Do I look elderly? This is not a course for the elderly. This is a course for for patients that are between the ages of 45 and 66. So sometimes people say, well, is this about how to do dentistry in a nursing home? I think those courses are fantastic. No, this is a course for people walking into your office. And so I want to make sure that from an event planning stage, that this garners a much larger audience than one that says relative to like a special needs course.
Got it. Well, and I would assume, I don't know the statistics, but, I was born in 1964, and I know I've got one foot in boomer and then whatever comes next, Generation X or something.
Right.
But I would assume, and so I'm currently 56, that there are a lot of people that are 60s, 70s, 80s, 90s, that are coming into dental practices. I would think that would be at least half of the patients that we're seeing. So, or greater. And that's just making an assumption. But thank you so much for sharing with us about this course, Sam. It really sounds like an interesting course. I would very much like to hear it myself. So for the event planner, again, you can visit dentalspeakersbureau.com or drsamlau.com to learn more about how to manage the 4 top dental conditions of today's baby boomer and all of Sam's other courses as well. Thanks again for being with us today, Sam. And thank you all for listening in. And until next time, be well. Bye.
Thank you.